So today we are looking at lower back pain in pregnancy, which is unfortunately very, very common. We're going to start standing as we look to start to mobilize and also bring a little bit of strength into the glutes. So gently strengthening the core and the glutes throughout pregnancy is a really good way to help reduce that lower back pain, as well as making sure we're stretching and mobilizing into that space enough as well. So taking the feet, maybe hip width apart, maybe slightly wider. We're going to start with our pelvic tilts. So giving yourself a moment to arrive on your mat today. You can bring one hand to baby, one hand to your lower back, and closing down the eyes. And just bringing that awareness to the natural rhythm of your breath. Noticing any sensations in the body. Anything that baby is doing, anything you're feeling. And then with your next breath in, we're going to tilt the pelvis forwards. So we're feeling that expansion through the belly, the ribs, the chest. And as we exhale, lifting, squeezing, gathering the core muscles together. Tilting the pelvis back into place, tucking that tailbone under. Inhale. Maybe swapping those hands over. You could release the hands if that's more comfortable for you. We're allowing that lordotic spine to curve here. Exhale. Squeezing those core muscles. Keep that moving for another 6 rounds. We have a tendency to accentuate this lordotic curve in the spine during pregnancy because of that increased weight that's now on the front body, but also that relaxing in the body and diastasis recti and those muscles in the front of the abdominals. So by exhaling and drawing those muscles back together, we're reminding the spine of where it should be. We're letting it have this lovely gentle stretch, supporting the weight of baby with that hand. I've lost count, but I think that might be 6, or this might be 6. And then releasing those hands if they were still there. Rolling out through the wrists, wiggling through the fingers. We're going to take the feet wider than hip width here. We're going to come down into some very slow tempo sumo squats. So we're working the glutes here and the adductors. So gently strengthening. So taking a breath in, activating through the core, and nice and slowly drawing those glutes down. Inhale to rise. You could keep the hands in front of you. Maybe the hands want to stay on the hips. We're going to go for 4 more. I'm thinking of squeezing through the glutes here to drive back up to standing. The core stays activated the whole time. Nice and slow, controlled movements. Working those glutes. Stabilizing with the core. Beautiful. And then we're going to bring the hands down towards the ground, sinking the hips, and then encouraging the pelvis to open here, using the hand on the inside of the knee to find a little bit more space there. And then we're going to bring it over into our tabletop position. So taking the knees nice and wide, big toes are together, and probably one of the best movement patterns for most things during pregnancy, bringing it into those pelvic circles. Specifically beautiful for that back discomfort or pain, build-up of tension, and really working with that intuition and just moving in a way that feels right for you, for your body, for your baby. You can tuck the chin right down and towards the chest. And then we're going to find a little bit of stillness. Bring those knees in from the edges of the mat. Take a breath in through tabletop, and as we exhale, chin to chest, rounding backwards into your cat. Inhale as we come through tabletop. This might be enough for you, depending on how big baby is. And we don't want to accentuate any muscle separation at the front here. So just be mindful if there's any tugging or pulling. Don't come all the way through to that cow, but if it still feels good, you could bring a little bit of an extra stretch through the spine there. And keep working with your breath, your body. And the next time we're in that cat, we're going to take the knees wide. We're going to actually sink the forearms down. So we're going to come into a puppy pose. So maybe we're on the forehead. If there's space in the back of the neck and the shoulders, we can take the gaze towards the front of the mat, keeping the chin there. Working with the breath. And then maybe we just find a little bit of movement through the hips, rocking from side to side gently. And then bringing it back into that tabletop position. Knees in from the edges of the mat and just wiggling out those hips from side to side. Sometimes just something as simple as a little hip wiggle or a shake can be really helpful. Maybe we want to make that again a bit more intuitive, adding a little bit of extra movement through the whole spine to relieve that pressure from the lower back. Working with the breath here. And then tucking the toes, sending the glutes high, downward facing dog. And then we're going to walk the hands and the feet towards each other, coming into our standing forward fold. Now just being mindful if you feel dizzy or lightheaded here, gently bringing it back down to Sukhasana, or your variation of your seated pose. We're going to wrap the arms around each other, allowing the torso to feel nice and heavy on the legs. Bringing it back to the breath. Slowly releasing those arms, rolling the body up to standing, rolling out through the fingers, the wrists, the ankles, and then finishing today with a nice deep breath in, palms together. Namaste.